Pregnancy is the most powerful feeling. To have a life growing inside you, there can be no bigger gift than that. But it's during pregnancy women are most susceptible to a plethora of diseases, especially gastrointestinal and liver disorders. In fact, gastrointestinal and liver function disorders represent some of the most frequent complaints during pregnancy. And so I spoke to Dr. Prakash Shankar from Aster Clinic and Hospitals to understand the best possible remedy and care available. One main issue is vomiting. How do we approach that?
Vomiting is the most common GI symptom in any pregnant woman. Actually, the vomiting starts at the 4th week of pregnancy and it keeps on increasing in intensity till 12th week. After that, it starts coming down. By 20th week of pregnancy, the vomiting would have been subsided to most of the patients. The other symptom is nausea, that is the urge to vomit. That is also more common, and that too will subside in the same manner. And most of the time, the vomiting can be managed at home itself by simple dietary changes, like taking frequent small meals, taking solid food and liquid food separately, and avoiding fatty food, taking more of carbohydrates, and avoiding odors like strong smell. These can trigger vomiting. There is a condition called hyperemesis gravidarum, which affects 2% of the pregnancies, when the mother will have severe vomiting compromising on her health. In that case, we need the patient to be under medical attention. Till then, the measures that I suggested can be useful.
Heartburn is also one major issue during pregnancy. How do we tackle that?
Heartburn is another common symptom, next only to vomiting. It actually occurs in the 3rd trimester of pregnancy, that is 7th, 8th and 9th month of pregnancy. And heartburn occurs because the acid from the stomach enters into the esophagus, that is the chest, that causes the heartburns. And this can be tackled with the diet control alone, like avoiding oily and spicy food, cutting down on the coffee, tea, etc. Usually this occurs because of the hormonal changes, so naturally after delivery, heartburns will subside by itself.
Okay.
When it leads to severe vomiting or blood vomiters, or when it compromises on the nutritional status, it needs medical attention, and we have very good medicine for that.
So it can be tackled very easily.
Yeah,
once it
very
gets
easily.
medical
Yes,
attention.
yes.
Doctor, what are the most common liver problems during pregnancy?
There are certain liver conditions which are peculiar only to pregnancy, and most of them are benign. They don't need any aggressive management. For example, cholestasis of pregnancy, patient will develop certain symptoms like itching, and usually after delivery it will come down. And other condition like acute fatty liver of pregnancy, which is a bit alarming situation where we may have to terminate the pregnancy. Good thing is that these actually occur at the last trimester of pregnancy, and the cure actually is the delivery. After delivery, automatically all these two conditions will subside. In the acute fatty liver of pregnancy, the mother will experience severe abdominal pain, headache, nausea, vomiting, and sometimes jaundice. This condition needs immediate attention, but fortunately it's very, very rare.
As you mentioned, itching, and I remember itching my stomach constantly when I was pregnant. So it is a huge issue that women face when they are pregnant. How do you tackle that?
The itching can be due to skin reasons as well as due to liver causes. Skin problems are manageable, quite manageable like any other condition. Sometimes the stretching of the skin leads to some itching. All this will settle after delivery. There is one condition, as I mentioned previously, cholestasis of pregnancy, in which condition the bile acid will collect inside the liver and blood, so leading to itching. And this condition usually manifests at the last trimester, like 7th, 8th, 9th month. The itching will be something very severe that patients even go into depression. Many a times the patients avoid getting pregnant again. That itching will be classically in the palms and soles, more at night. The intensity will be highest at night. And good thing is the delivery of the child will relieve the symptoms. And there are good medicines to relieve the itching symptoms also. This is a very benign condition. But the patient needs medical attention just to rule out any other liver disease.
To tackle all 4 issues, what are the simple lifestyle changes pregnant women can do?
First thing is they should not compromise on the nutrition, because the nutrition is going to the mother as well as the baby, and they could get a dietitian advice. And frequent small meals, avoiding being in empty stomach will take care of the vomiting. Spicy oily food can be reduced to avoid the heartburns. And as far as the liver is concerned, there is actually no dietary change, just that most of the conditions will improve after delivery. The understanding of that will give them
and be aware of it.
Yes, yes, yes.
Thank you, doctor.
Welcome. Thank you.